Selamat siang. Welcome back to another Bali COVID-19 update. This is February 9th, 2022, and my name is Bruce. What is the weather like today in Bali? The humidity is 77%. It is 29 degrees Celsius, and the wind speed over here on the balcony today is 1 kilometer per hour, nothing. Okay. There are two main stories as usual in this video. The first one is that Bali has moved to level 3. Okay, not unexpected with the spike in numbers. And there is an addition of hotels planned for the warm-up program. And so that's good news if you are planning on coming here sometime soon. You will have more of a choice now and, well, cheaper options, which is always good. Numbers are still high and expected to stay at this level or go higher for the rest of the month. And, well, at the update, there's kind of a depressing comment from the epidemiologist from Griffith University in Australia, Pohlmann. I have a bit of a cold right now, so I'm going to make the wrap up really short because I want to lay down and take some medicine. Let's get on with the numbers. The 7-day average for new positive cases in Bali, 1,659. Yeah. And the 7-day average for deaths, 4.7. So neither of them are very encouraging. Yesterday, nationwide, 37,492 new cases and deaths, 83, and there is an update on deaths at the end of the video. How about testing? Testing in Indonesia yesterday, 284,638 with a 13.17% positive rate, and the 7-day average positivity rate, 11.31%. Okay, so numbers are not that good. What about testing in Bali? Over the last week, 65,892 individuals were tested with a positivity rate of 14.98%. And what about vaccination numbers? First dose, 3,905,281, 86.4% of the population. Second dose, 3,506,583, 77.8% of the population. And boosters, 346,012, 7.7% of the population. So boosters are going slowly. Yesterday in Bali, 17,919 additional doses were administered. And what about the new cases in Bali? Whoa. New cases in Bali yesterday, 2,425. Recorded deaths, 5. And active cases, we are now up to 12,815 active cases in Bali. Okay, so the numbers are not good, and unfortunately it looks like we're going to be in for this for a while. Let's get on with the main story. The main story is Bali is moved to level 3. Government ratchets up COVID-19 curbs. So the agglomeration areas of Jakarta, Bandung, and West Java, as well as Bali and Yogyakarta provinces have all been upgraded to level 3 for the coming week. This was announced, as usual, by Pak Luhut on his Monday night announcements, and he said this is not only because of the increase in cases, but also because of low test tracing rates. Bali has also increased because of a spike in hospitalizations. Jakarta's Sunday caseload was up to 15,000, which is a previous city record of 14,500 new cases recorded during the Delta variant in July. And Bali also recently broke the previous daily caseload of 1,900 cases from last August. Bali and Jogja, as well as Jakarta and Banten and West Java, which are hosts to the cities that make up the greater Jakarta area, all rank among the provinces with the highest bed occupancy rate, BOR, in the country. And even though Jakarta, Bandung, Bali, and Jogja have their peak PPKM levels raised, Pak Luhut said the government has made a number of adjustments to the current level 3 curbs, so they're less strict than they were before. And he said this is because of Omicron. So previously, for level 3, the capacity for supermarkets, malls, and restaurants was limited to 50%. It is now 60%. And level 3 curbs also previously mandated that public facilities be closed and some art and cultural activities be suspended, but the new level 3 curbs allow for public places as well as art and cultural activities to operate up to a 25% capacity. So a little easier than before. Experts have welcomed the government's move to tighten restrictions. University of Indonesia School of Medicine professor Adi Thomas said that it was clear that the current situation is far different than what it was in December and January. He said we can't afford to stay at level 2. And he added that the government should be ready to apply stricter curbs in the coming weeks if cases continue to rise. And epidemiologist Paddock from Griffith University, talking about him, of course, all the time, urged the government to proceed with caution in applying more lenient curbs than previously. And you know, he is known for being very cautious about this. He suggested that such leniency with regards to premise capacity would only be safe if an area has fully vaccinated more than 80% of its population and provided booster shots for 50%. According to this article, Jakarta, Jogja, and Bali have fully vaccinated more than 100% of their target population, not real population, target population, while Bandung is at 95%. However, none of these areas have managed more than 10% of the population for booster shots. Paddock said, if these adjustments prove too risky, I don't think the government should allow them. He also applauded the government for admitting the lackluster tracing efforts, saying that aside from mobility curbs, tracing and testing efforts remain essential in facing the Omicron variant. Luhut said that the curb adjustments were a result of different characteristics of the Omicron variant compared with Delta, as the government is aiming to keep the vulnerable members of society safe while keeping the economic harm to the country at a minimum. He said, we'll be monitoring the new curbs over the week. If the results are good, we will relax them next week. Along with new level 3 curbs, the government is also aiming to accelerate Indonesia's vaccination efforts and increase the capacity of COVID-19 beds and hospital services, as well as mobilizing isolation centers for asymptomatic COVID-19 cases. At the same press briefing, the health minister, Paddock, said that just under 19,000 of the 120,000 hospital beds around the country have been filled. And he said 10,000 of those are from patients who are either asymptomatic or have mild symptoms. And he noted that more than half of the 58 patients currently experiencing severe symptoms were either yet to be fully vaccinated or are completely unvaccinated. And the minister also noted a similar trend with recent mortality rates, noting that 69% of COVID-19 deaths since January 21st involved those people who were not fully vaccinated. In other words, get vaccinated. So far, Indonesia has managed to fully vaccinate more than 131 million people, or 62% of the country's target population. But vaccination rates for elderly continue to lag. As of Monday, only 10.5 million senior citizens, or just under half the target population for that age group, were fully vaccinated. And Paddock said that full vaccinations are very important in order to protect that population. And so it is what it is. We are at level 3. Take a look at the segment on isoman, on people that have been self-quarantining and what Bali is doing to that, and Koster, Governor Koster's comments about that following directly that segment, and you can see where we're at. And now let's go into some better news about adding hotels to this bubble program. It has been a busy and confusing 18 hours. There is all sorts of new information out, and a lot of it contradictory. If you've watched this channel before, you know that that is not unusual. And, well, I think they've even outdone themselves this time. So I spent a lot of time trying to sort this out, and I think I have what is the most recent and, well, reasonable interpretations of this, although you can never tell these days. There is so much craziness going on. Too many cooks as usual. Too many cooks, too many chefs, too many ministers, all saying something different in their own ministries about the same things, the same topics. This is Tuesday, and so I've spent from last night, and I finally just gave up It was just too confusing. I had a couple of vodka and tonics and went to bed and started again today. And it's still confusing. This segment is, well, one of the least confusing ones. Ministry of Tourism and Creative Economy will add bubble hotel in Bali for warm-up vacation program for PPLN. And PPLN, in case you forgot, are overseas travelers. So the ministry is planning on improving the experience of coming to Bali under the warm-up program or warm-up scheme, and they're going to improve that by adding hotels. Now, that could be a good thing for those of you that have already commented on how expensive the hotels are, how expensive everything is. Yes, it is, certainly. And so there were 66 hotels originally that were okayed by the ministry to work as quarantine hotels. That was kind of shelved for 5 hotels, and now they're looking at adding some more. So the 5 hotels that they've got are the hotels where you can do this bubble activity. You can get out and you can wander around in the hotel grounds within limitations. But it's possible to just stay in your room. They're looking at freeing up some hotels to give you more of a choice where you'll be restricted to your room for 5 days, but you won't be paying the premium price. So currently there's 66 hotels that have been approved by the COVID-19 task force and the Ministry of Tourism and everybody else that approves these things. So the number of hotels that will facilitate the warm-up vacation program are going to continue to grow, and right now there are 19 others that have proposed to become bubble system hotels, but their readiness still needs to be verified. According to a spokesperson for the ministry, in the future the number of quarantine hotels with the bubble system will continue to be added according to the needs and results of field verification. This is intended so the PPLN can have a variety of choices according to their taste. Why don't they just say tourist? He continued, in quarantine hotels that do not implement a bubble system, PPLNs are only allowed to move in their rooms or villas. They're not allowed to go out. But uniquely in Bali, there is a choice of quarantine hotels that offer villas with private pools. So PPLNs can feel a more pleasant atmosphere compared to quarantine in other areas. Well, I think they're thinking about Jakarta. Currently, there are 61 regular quarantine hotels with more than 3,400 rooms. And also, in supporting the Bali warm-up vacation program, he added that the application for e-visa visiting Indonesia was also made easier. Tourists can now directly check the regulations at the Ministry of Law and Human Rights for the submission and application of the e-visa, but you can't make it. In addition, the Immigration Office also provides a hotline for travel agents who arrange e-visas for tourism. So you still got to go through a licensed agency or the hotel to get your visa. You can't do it, but you can check what the requirements are online, and you can also use the Bali Hotels Association website, the link down below here where it says Bali Quarantine Hotels, I think. It's down at the bottom of the links. According to the Deputy for Marketing at the Ministry, Nia Niskaya, and I talked about her before, one of the tourists from Japan who took part in the Bali warm-up vacation program at the Grand Hyatt Bali said the program was interesting because she could enjoy the facilities at the hotel outside the room like a staycation, which has become one of the choices of tourists since the pandemic. And she added, this is kind of funny. So far, I am satisfied with the packages and facilities provided in the bubble scheme. Today, I received an electronic message from a Japanese journalist in Tokyo who said he was interested in exploring the idea of Bali warm-up vacation. And so, yeah, we're going one tourist at a time. I don't know. What can I say? Sometimes this stuff is so ridiculous. It's one tourist at a time. We're going to go one tourist at a time. But this is good news if you are one of the people that want to come in on the tourist visa and the B211A tourist visa and you want to come directly into Bali. If other hotels are provided and and you don't mind being stuck in your room, hopefully you'll have a balcony for 5 days, you'll be able to get a cheaper price. There is a list, as I said, down below. You can take a look at those and take a look at the prices. I don't know if they're going to stay the same once they join this program, but it gives you an idea that some of the places are considerably cheaper. I hope that if you are going to come under this program that you let us know here and leave a comment, because I would like to see how many people are taking this up. I'm waiting with great interest for February 16th when Singapore Air is supposed to come and see how many people show up and how it goes. And we're getting closer and closer, only another week away. And what has Pak Luhut got to say? The spike in COVID, Luhut asked the elderly not to leave the house for the next month. Now, when I saw this goes to don't take things, you see a headline and just assume, because I thought, okay, he's asking all the elderly people not to leave home. No, that's not what he's doing. He's asked residents age 60 and over who have comorbid diseases and have not been injected with the vaccines not to leave the house for the next month. And this is a request, a suggestion, not an order. He said the existing data shows that most of the people that have died were elderly people who had comorbidities and who had not been vaccinated. And he says, this is important, but we shouldn't take this Omicron lightly because this Omicron can also damage our bodies. And Pak Luhut added that for cases with mild symptoms, they should self-isolate and undergo treatment at home. However, patients in the elderly category should immediately be taken to a hospital or a centralized isolation area. And Ibu Tarmizi underlined all this and said that comorbidities were the reason for the surge in COVID-19 deaths in recent times. She said many of the positive COVID-19 patients have comorbidities that have caused the death rate to rise dramatically. The comorbidities in question include hypertension up to diabetes. So I said in other segments, a lot of weirdness has been going on, right? We have Bali's opened up amidst the spike, and well, we've gone back to level 3. Let's see, another segment for that. And there are questions about where people can go. Can they come into Jakarta? Can they come into Bali? The Ministry of Transportation said one thing, and then they changed it a little while later, and it's reported in the international press. No, you can't fly in to Jakarta. Wow, it's mind-boggling. And, well, I'm going to have a few more vodkas tonight to ease my headache with all this. And what's happening here in Bali with COVID? Bali Provincial Government will transfer isoman COVID-19 patients. What are isoman patients? Isoman patients are people that are staying at home. They're quarantined at home, doing self-isolation. The Bali Provincial Government will immediately transfer confirmed COVID-19 patients who are undergoing independent isolation, that's isoman, to a centralized isolation location. This makes it even less likely that you're going to see people going in to get tested. In addition to transferring patients who are isoman, it is also accompanied by the preparation of adequate centralized location facilities and the anticipation of increasing the need for bed in hospital. And listen to the numbers and then tell me how this is working. Okay, so here are some numbers. So out of COVID-19 patients in hospitals, health centers, and centralized locations, 954 people, 9.65%, were hospitalized. 1,551 people, 15%, were in centralized isolation. 7,382, 74.66%, were in self-isolation. Until now, there are 90 centralized isolation places spread across the 9 regencies, cities in Bali province, with a total capacity of 2,110 beds, and 1,551 beds have already been filled, 73.5%. So you've got 2,110 beds total, and 1,551 have been filled. And how many self-isolation patients do you have that you're going to move in? 7,382. Where are the beds coming from? There is a big difference there. You've got, what, less than 600 empty beds, and you're going to stick 7,382 people in them? This is another questionable move. And as I've said many times before, I don't make the rules. I'm not an Indonesian citizen. I don't work for the government, and so they make the rules. And I'm always careful about how far I go in criticizing or making fun of the government because, well, I'm here at their pleasure, so to speak, and so I don't want to get kicked out. Fortunately, this channel is not that big. And more on this, the cumulative number of recovered patients confirmed positive for COVID has reached 88.84%. The number of recoveries is far below the daily number of new cases, which results in a burden of hospitalization and centralized isolation. So why are we going to put more people in there? According to the governor, those who were confirmed positive for COVID-19 without symptoms and mild symptoms should immediately take the initiative to carry out centralized isolation that has been prepared by the government, and they are prohibited from self-isolation at home so as not to infect their families. Most likely they've already infected their families. Who is going to go willingly? Meanwhile, those who are confirmed positive for COVID-19 with moderate and severe symptoms should immediately go to a referral hospital in their respective areas in order to avoid worsening conditions and endanger themselves. And the governor said, although the case of Omicron variant is growing very quickly, he said to remain calm, not panic, and remain vigilant. We must continue to obey and implement health protocols and apply a healthy lifestyle free from COVID-19 with the 6 M's, namely wearing standard masks properly, washing hands, maintaining distance, reducing travel, increasing immunity, and obeying the rules. And I was out in downtown Sigaraja today with the grandkids, and wow, there are more people than usual not wearing a mask today. So what is happening here? And here is an English translation, and the link is down below if you want to see it from the governor, what the governor said yesterday about the restrictions here. Considering that new cases of Omicron variant COVID-19 are growing very fast in Bali, as well as preventing the spread of Omicron variant transmissions, I instruct you as follows. Temporarily stop face-to-face learning until the situation is conducive, so that all new cases of COVID-19 without symptoms are isolated centrally. Do not allow self-isolation. Setting up a centralized isolation facility as needed. Intensifying the implementation of 3T, testing, tracing, and treatment, in synergy with the head of resort police and the military. Limiting community activities that cause crowds. And finally, strict implementation of health protocols as we can convey. Thank you for your attention and cooperation. And so that is that. And speaking of masks, here's a story on Denpasar and PPKM level 3 and inspection on mask intensified. 14 people netted in a raid in Penatih village. So there was an inspection of masks on Tuesday held in front of the Penatih village head office. And out of the inspection, 14 violators were caught. Of those 14 violators, none of them were fined. According to the head of public order and public order of the Denpasar City Police, Nyoman Sudarsana, he said, we conduct inspections in a humane manner. We remind them to always wear masks. He said, I don't understand whether they really forgot or they're just looking for an excuse to dodge. And coincidentally, when there was a raid, they were caught. It should have become a habit. How can you not have a habit of wearing a mask after 2 years of having to wear a mask and you forgot it? So these violators were not fined. So what happened to them? Well, they were asked to memorize Panchasila and do push-ups. Tough. That is going to make people remember to wear masks. And here's a story that is causing confusion everywhere. Internationally, CNN, Reuters had stories about this. The Indonesian press has stories about this. Jackie Pomeroy's COVID-19 has a discussion on this. It is everywhere. Ministry of Transportation correct statement. Foreign tourists can still go through Soetta, through Soekarno-Hatta Airport. They can come in through Jakarta. Now, I thought they couldn't come in through Jakarta. Originally, it was if you had a tourist visa, you had to come in through Bali. So then at some point, apparently it became okay to come in, but then it was not okay. Now it's okay. And so, confused? I am completely. And fortunately, I'm not the only one. So now the Ministry of Transportation said the foreign travelers for tourist purposes can also pass through Soekarno-Hatta Airport. Okay. And there is a very good, I'm going to put the graphic right here. It's from the Bali Hotels Association. You can take a look at it. You can click on it, blow it up. A spokesperson for the ministry, Fitri Indah, explained that the corrected sentence should be, the sentence that was causing some consternation, should be restrictions on entry points for Indonesian citizens and foreigners traveling abroad for tourist purposes can only go through I Gusti Ngurah Rai Airport, Hang Nadim Airport, Batam, and Raja Airport, Haj Fisabila, Tanjung Pinang. And she said the sentence should read, restriction on entry points for Indonesian citizens, foreigners traveling abroad for tourist purposes can go through those three airports. So only seemed to be the key word here. So according to her, you can go through Jakarta if you were on a tourist visa. So I'm confused. I imagine they're gonna iron this out eventually. As I said in the last video, boy, I would not come here right now. I'm sorry. I want tourism here. I want people back to work. I want my kids to be prospering economically and mental health by having jobs. People are saying all sorts of things. Rules changed constantly. I would chill a little bit and see how things get sorted out until the pandemic is over. Well, not the pandemic is over, until this surge of Omicron is over. Thus, foreign travelers for tourism purposes can also go through Soekarno-Hatta Airport. We need to emphasize this as well as clarify the various reports that have been circulating. If you have this worked out, please let me know. If you see something that is updated, I'm still confused. At this point, right now, Tuesday at 2:30 in the afternoon, as far as I can make sense of all this, if you have a tourist visa, you can come in through Bali, you can come in through Riau, Bintang, you can come in through Jakarta. Maybe that includes Manado too. Let's go on to the next story. And Malaysia has started vaccinating children. Yelps tears as Malaysia starts vaccinations for young children. I love this title because when they do stories about vaccinating kids in Bali, the stories always start out that the children are smiling and happy and laughing and everybody is having a good time. That's completely opposite, and I think more real. Malaysia started its mass vaccination program for children between the ages of 5 and 11 this past Thursday in order to protect the youngest members of the population and increase the high immunization rate. And the story says, young children sat anxiously with parents as occasional yelps of pain were heard echoing through the halls. I know my granddaughter wasn't happy about it either. The inoculation program will add to Malaysia's success in vaccinating most of its people. Nearly 80% of the 32 million people in Malaysia have received at least 2 doses, and that includes almost 98% of adults. Wow. If these numbers are right, that's incredible. In the past 6 months, 147,282 children have been infected with the virus and 26 have died. I wonder how many children in Indonesia have been infected, in Bali in particular. So a good move on Malaysia's part in order to make the whole population safe. And what's happening in Thailand? Ministry to propose relaxation of virus curbs. This is getting to be a trend. The Public Health Ministry is preparing to propose a relaxation of measures to the Center for COVID-19 Situation Administration, CCSA. I've mentioned them many times talking about Thailand. And they plan to encourage people to live with the coronavirus as opposed to imposing lockdowns during outbreaks. According to the Director General of the Ministry's Department of Disease Control, DDC, the global situation of COVID-19 seems to be moving in the same direction. Many countries have started to ease measures despite spikes in daily infections. And according to Dr. Opas, the ministry believes Thailand should no longer impose lockdowns as people need to learn to cope with COVID-19, which will soon reach an endemic stage. And of course, as in all articles, this one talks about the high transmission rate and that the effects are less severe. And according to the good doctor, we need to get people to understand that the number of daily new cases is nothing to worry about. And so we get this, some people say it's nothing to worry about, other people say don't let your guard down. It gets confusing, doesn't it? Confuses me. On Sunday, Thailand had 10,879 new cases, including 178 imported ones and 20 new deaths. According to Dr. Opas, home isolation measure for patients with mild symptoms has proved effective in keeping hospital beds reserved for patients showing more severe symptoms of the disease. And this is another thing that seems to be the trend now. And he said parents should consider bringing their children in to get vaccinated against COVID-19 if they have not already been vaccinated. However, despite the general trend towards easing curbs, Mahasarkham, which is a province up in the north of Thailand, has announced prohibition of dining activities, including weddings, meetings, ordinations, and funerals, and that became effective on Saturday. Violators are liable to imprisonment of up to 2 years or a fine of up to 40,000 baht under the emergency decree on public administration in emergency situations. What about MotoGP and what the government said about MotoGP being subject to the quarantine like everybody else? Guess what? The government's gone back on that one. MotoGP Paddock subjected to special travel bubble quarantine. The Indonesian, you can hear the feral children in my neighborhood. The Indonesian COVID-19 Task Force Management Head Alexander Ginting on Monday confirmed that MotoGP riders and racing officials will not be required to undergo the country's centralized COVID-19 quarantine as they arrive for the pre-season testing of the newly built Mandalika circuit. I don't know how many videos ago it was, but government ministers, Pak Sandiaga Uno, said they will do the quarantine. Okay, they will not do the quarantine. Pak Ginting said it is possible to do this because of the travel bubble established between the Indonesian government and the motorcycle racing series organizers. The quarantine bubble states that riders and officials must enter the Mandalika travel bubble area through the Lombok. They are also restricted to interacting with people who are included in the travel bubble and areas that are mentioned in the circular. Okay, so their area of getting around is going to be restricted. My cat is wandering around here, getting in my way. The area that they can wander around is going to be restricted, but they are not going to do the quarantine. The travel bubble scheme was established after Dorna Sports CEO Carmelo Espelita once commented in a GPON interview that the MotoGP race will not be held in countries that require the racing paddock members to undergo a lengthy COVID-19 quarantine. And so the government backed off on that one. In the last video, I talked about 2 instances of schools going back to online learning. I talked about Klung Kung and Bulaling. Well, in accordance with a circular letter from the governor of Bali, face-to-face learning, PTM, now here it's called PTM, has been temporarily suspended. Parents are busy again with online learning. And so going back to distance learning or online learning is making parents nervous. That's the substance of this article. It's just talking to a number of parents who are upset about this and say, home study is time consuming, it's interfering with our lives. The article is basically a discussion with a few parents about how busy they are, they have jobs, they're trying to make money, they have other kids at home. It's too time consuming, the kids don't want to do the work, they're lazy, they don't hand their assignments in on time, they want to go out and play. All of those are problems, right? Exactly. And everybody should be thankful for teachers. I hope one thing that the pandemic has done around the world is made people more appreciative of what we do as teachers. And so how long is this going to last? Hard to tell. But I hope that it does not last too long. My granddaughter is another one. She would just as soon play if she's at home than study. But she's pretty good about actually doing her assignments. Okay. It's time for an update and wrap up. And the update, elderly accounts for 44% of COVID deaths since Indonesia detects Omicron. So they're 44% of the population according to this article. And you know that numbers change and they never seem to be the same from one story to the next, one minister to the next. We know that elderly patients are higher risk for severe cases and for deaths. And so that's basically what this says. And so it means if you are in the elderly population, like me, you need to be careful. Epidemiologists optimistic COVID-19 surge will drop before Eid holidays. The Eid holidays are in May. So Pagdiki Budiman shared optimism that the wave of COVID-19 transmissions due to the Omicron variant in Indonesia will stop before the Eid holidays in early May. He assessed that unwanted situations during the upcoming Eid could be avoided on conditions. And so that's a long time. I was looking at what other people are saying here about this ending in the end of the month or early March, not in May. We just don't know when this is going to stop. And so we're in the wave, and we're just going to have to ride with it at this point. And what's the wrap up of this Ed Short, because I'm not feeling really well today. So some interesting comments about masks, and there's a couple segments that I had about this, and some news in social media today, people talking about going to Odalan ceremonies and other ceremonies, and almost everybody not wearing a mask and crowded together, as you always get at those ceremonies. And go into supermarkets and you see the foreigners not wearing masks or wearing them below their nose. And as I said in the previous segment, yesterday I noticed more people than usual not wearing masks or wearing them in the incorrect position. And so despite the fact that we're in the surge, people are getting lax, and well, that's not a good sign. In another segment, I talked about what I would do. I would not come here right now with the surge and with uncertainty about the visas and hotels and hospitalizations and isolations. It's just not worth it, in my opinion. As I said, I really want to see tourism start here, but if I was coming in from outside right now, I would wait a bit and see what happens over the coming month. But everybody has their own plans. And so we're 1 week away from Singapore Airlines, right? This is the 9th, and Singapore Airlines is supposed to come on the 16th. Will they have passengers? Will people want to come to Bali if we're at level 3? Will the government allow the plane in? There are so many questions around that. Hard to tell. Is the quarantine going to go away? No way. Not for a time. I would not count on the quarantine disappearing. And in terms of VOAs, visas on arrival, I don't see that happening anytime soon either. But you can never tell here. So wherever you are, stay safe. Be kind to someone today. Thanks for viewing. If you found this information useful, helpful, amusing, not irritating, please give it a thumbs up. And if you haven't subscribed, please consider subscribing. And I will see you on Sunday, I hope.